Oh my god, oh my days, oh god. Guys, welcome to my YouTube channel. My name is Abimbola Falabi. I'm a registered nurse in the UK. I'm a mom and also an amazing wife. If you're a returning subscriber, you are the real MVP. And if it's your first time stopping by, please like, subscribe, and share and watch the video to the end. On this channel today, we'll be talking about my experience as a nurse in the UK and also my experience as a nurse in Nigeria. But before I dive into the video, I want to show you an amazing scent uh, I got today, and I feel like it's worth sharing. You know, when you buy something and you actually get value for what you got, and that is just what this perfume is all about. Unboxing, 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 and right in, I've got my Dior, J Dior, J Adore Dior perfume. I've tried Dior Savage before, and it's actually nice. But I feel this one is actually a lot like more chilled. It smells very nice, and it also lasts longer. Because I've unboxed, the perfume before, and I've had a nosy look at it, and I also like the the look of the perfume. Like, it looks a lot um girly and a lot nice. Can you see? It's giving some sort of Arabian perfume look. What is so nice, so nice. And I also got a free gift from the brand I got it from. I got a Givenchy perfume, and the combo is actually amazing. It smells so nice. I've not gotten over it, honestly. I've not just gotten over it. I'm actually crazy about scents. I like smelling nice, and that's just a new um is it craving, I'll say, but that's just a new development about me, like liking perfume. Because previously, even before I got married, like, I wasn't a fan of perfumes as such. I'm just like, let me have my roll on, this casual. Let me have my Nivea, let me have my um Dove roll on, the antiperspirant roll on, and then I'm done, and I'll just buff off with like a spray. But recently I'm like crazy about scent and perfume. I'm constantly checking perfumes online, checking reviews. With this new craving, I hope my salary or my account balance will be able to will be able to sponsor it, because I'm like, what in the world? Anyways, so today we'll be talking about my experience as a nurse in the UK and also my experience as a nurse back in Nigeria. And today we're talking about the positive sides of both parts, because yeah, the positives, just the positive side. As we know, there's always two sides to a coin. There's always the bad and the good side, and I'm just going to be talking about the positives and also the differences in between, but we'll be focusing more on positive sides of being a nurse in the UK, just to give nurses back home in Nigeria some sort of, idea of what to expect when they're planning to migrate into the UK. Accountability as a nurse back in Nigeria and also as a nurse in the UK. I'll give this sort of scenarios to both locations. While I was in Nigeria, I've seen like a lot of stories, maybe online, and also with like the recent passing of a very influential musician, and a lot of stories on, this medical negligent stuff happened in a hospital, or happened in patronage of like a quack nurse, or happened in patronage of like a medical center or stuff like that. And that's where like the accountability comes in, because back home in Nigeria, I feel like unregistered personnel are not very accountable. I'll speak for on the registered part, because I'm a registered nurse in Nigeria but in the UK. I feel like unregistered personnel are like very unaccountable, because during my experience in the UK, I've noticed that everyone is accountable for whatever like you are doing. You're accountable for like whatever responsibility you are put in. Even if you're a cleaner and you're assigned to clean like a unit, or you're assigned to clean like certain areas, if there's anything that has to do with cleaning, or like the checks, when it's been checked, like the checklist, this has not been done, that individual is held accountable for it. But back home in Nigeria, I feel like especially the unregistered individuals, like the quack nurses and all of that, they are very, very unaccountable for things. And when they you know, perform all these atrocities, they end up pushing the individual back into the hospital. And okay, you are very accountable for what you do. Everything you're doing, you need to know what you're doing, you need to know why you're doing it, you need to do things with evidence. As an evidence-based nurse, you need to know what you're doing. Or why am I giving this medication? You can as well question medication, question things. And this is like one thing I actually love about it in the UK, because there's sometimes I've been like, oh doctor, please can I have a chat with you? This patient has just been prescribed this, I don't know why the patient is on that, is there any, do you understand? And the doctor sort of carries you along, like, oh, we've just done a CT scan, just done this, and like, oh, the patient is that, and that's why we prescribe this medication. Do you get? Because you as a nurse, you're the one giving that medication. Even regardless of the doctor prescribing it, you've got some background pharmacological knowledge that you should know that, oh, this medication, if I give it to someone with this or with this allergy, he is going to react. And there's sometimes that some things are being left out in between, like, oh, patient recently developed an allergy for a medication at home, but it wasn't recognized in hospital. So that's where your nursing judgment comes in, like, oh, can you tell me your name and date of birth? Have you got any allergies? Stuff like that. And the patient will be like, oh, I've got allergies to penicillin. Oh, and you'll be like, it's not in the system. I'm sure people in the UK have like experienced this sort of, you know, discrepancies. Sometimes it does happen. And you're like, oh, it's not in the system. Or you've been prescribed tazobactam. Or I'll let the doctors know, and then you get it sorted. But I feel like in Nigeria is not really like a thing, and things happen and can be, you know, just pulled on the side. But here in the UK, take accountability very, very important, because you have your PIN to uphold, you have your PIN to, you know, to protect, because without that PIN, you know, you won't be able to practice as a nurse in the UK, and that is very important as a nurse. So I go to my next equipment, standardized equipment in the UK, and that I know that is a part that we're really lacking on back home in Nigeria, because I've experienced a lot of issues, even as a nurse, as a student nurse, and even as a nurse. I trained in one of the federal hospitals, and I've experienced some first-hand things that had to do with like with, you know, equipment. And also I've also been a patient in the federal hospital as well, so I've noticed that, oh, there's a big gap. So when I newly came into the UK, when I was still on like probation, you know, your first 2 weeks in hospital, starting, you're learning a lot of things, learning how things are done. So we had this personnel come up on the ward with like a mobile thing, like a mobile screen. It's a very big machine, but like a mobile, it has like a laptop screen on the side, and it was just like, you know, a lot of things going on. I was amazed, and I was like, oh, what's that? And they were like, oh, it's the mobile x-ray whatever, that we've got a patient that needed a chest x-ray, and the patient could not be moved to that, you know, to that unit, and the person had like a sonographer or like a radiologist personnel following, bringing down the mobile x-ray to just do like that x-ray. And I'm like, oh, I'm very, very amazed. And even as a nurse, I've learned like a lot of things with like, oh, doing a bladder scan, you know, getting to see different equipment, different things, learning a lot with like different things. Because most times what actually happens is we end up seeing these things in like textbooks, like in our Brunas and Sudats. There's vocabulary. Nursing student in Nigeria, you know that there's book. So you end up seeing the video, the picture, on this textbook and you're like, oh, I love to see this thing. Do you understand? I love to see this scan, like all this CT scan, PET scan, MRI and stuff like that. Like they have a lot of standardized ones. I'm not saying we don't have them in Nigeria, but they have a lot of like standardized ones and I'm like, oh wow, amazing. Do you get? So those are just like my way in between. And because you have a lot of you work with a lot of equipment, you know, you end up understanding that, oh, this thing is like this is like that. Do you understand? So it gives you like a lot of, because those things, those equipments are things that they put you on training for. Like we do medical devices training. When you know, when you come back from Nigeria, you've not got a lot of experience with like medical devices training. Some people worked in like private facilities whereby they don't even use like a fluid pump, they don't use like a transfusion pump, and you know you have a syringe pump as well and everything like that. So those are the things that you need to pick up, you need to, you know, learn. And when you come here, you're given you're given like all the training you deserve, you know, to put you onto that, like give you that knowledge that you'll be able to function properly and perform optimally in your duties. So that's another like difference. Trainings, yeah, that's like what I just said with equipment and training. Like you constantly have trainings. While I was working in Nigeria, I don't think the hospital I worked in my 2 years of working ever like planned any training for me. And I know a lot of people are like, oh, okay. Yeah, because I think we end up doing our trainings like when we're about to renew our licenses, like having a CPDP whatever to renew your license. Most hospitals don't really do any training for staffs in Nigeria, but here in the UK you're constantly having trainings. Like I've been working in the UK for over 2 years now, and I've been a nurse for 4 years in general. So I have done like a lot of training in the UK for the past 2 years, like constantly going on trainings for pain management, for medical devices, for different specialties, critical care, how to identify if they're rating patients. Like if I start listing them, it's going to be a lot. I do a lot of trainings, like physical trainings and like a BLS training as well. You have to do that, you know, for your resuscitation and stuff. You end up going on training in and out. And you've also got mandatory trainings that you need to do on your own online. So like the training is unending for you. You just, and it sort of puts you on the edge and gives you like a sense of understanding, to understand things better, to be conversant with like new practices and new occurrence of things in the world, like things that have been introduced in the world now. Oh, this is a new finding, this is a new research, so some things are being scrapped out and you're on the ball with your practice. That's a thumbs up. I like that aspect. And next thing I'll talk about is career development. And I feel like career development in the UK is individually triggered. It's not something that is automatic for you. I feel like it's individually triggered, and I feel like it's not really not really a straight line for you to go into. It's really individually driven. Like if you want to have that career development, it's up to you now. Because back home in Nigeria, when you work a certain years, you end up being moved. If you're a nursing officer, you move up to NO1, NO2, NO1, then you move to CNO, you move to PNO, then sorry, not CNO. Have I forgotten so fast? NO2 and NO1, NO2, you move to PNO, principal nursing officer, then you move to CNO. But like you have those years, I think after 2 or 3 years, they automatically move you from a particular pay scale to another pay scale. But here in the UK, it's nothing like that. If you're a band 5 nurse, you have like a range of amount you'll be paid, and that will be like, oh, band 5, you've been band 5 for a year, a certain amount, your salary will be increased, but you're still within that range of the band 5 pay. So if you stay in that scale for like more than 6 years, more than 10 years, you still get that same pay for more than 10 years. So it's up to you to like opt yourself to move on to the next band or move on to the next paying scale. So I feel like that is very detrimental to a lot of individuals, because I've seen a lot of individuals like they've been a nurse for like lots of years and they've not gotten any career advancement, and they're like a bit confused. Oh, what do I do? What do you understand? So it's a bit of a hustle to move up your band, because everyone is sort of struggling and trying to get onto the ladder. But back home in Nigeria, it's like you get promoted for like directly. I don't know if it's changed now, but you get promoted to like that certain ladder depending on your level or years of experience. And I think when you go some certain levels, some things are like criteria, if you've got a degree, if you've got masters, if you've got, yeah. But here in the UK, you can have a lot of nurses like have degrees in nursing, like they did masters in nursing to like breach into nursing, and it doesn't really count on your your career development, like your growth in your career. The only positive part of being a nurse in the UK is like when it comes to like CPDP training, learning, being on top of like what you're doing, you get that learning constantly because you're constantly put in that environment of, oh, I need to learn, I need to understand this. And because you see a lot of conditions daily, a lot of procedures being done, it puts you on your toe to sort of like read up about it, like, oh, let me just read up about this thing, oh, let me just read up about this thing. And then like it makes you very, very proactive. Now let's talk about is availability of everything, like everything you need, because medical care in the UK is free, and I feel like this has sort of like helped, because back home you've got to pay for everything that you're being, you know, treated with. So it sort of puts a strain on some of the nurses sometimes, because when you're about to give certain medication, the patient has not got it. It's, you know, it sort of affects their care or their like outcome. And another thing I'd like to talk about is like back home we do a lot of improvisation. We improvise with things when supplies are not available. We improvise. I'm not going to be mentioning the means that we will improvise, but anyone that's a nurse back home in Nigeria, you know that you constantly improvise with things that are not available just to make sure that you get the job done. But here in the UK, everything is available. You've got your supplies. Like my first day working was a bit, you know, it was as if I was just like, okay, okay, okay. Like we're trying to make up medication, got into the medication drawer. There's a lot of medication in there. There's a lot of supplies, IV fluids, everything. Like everything is readily available. And even if you've not got it on your unit, you can always ring the pharmacist like, oh, we need this medication for this patient, blah, 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 blah. And you also put in an order. And if you need it urgently, like once you bleep the pharmacist, they can get it out down to you. And even at odd hours, maybe at night or something, there's always like what's it called, like an emergency drug cupboard that you can just bump into. You have access to it as a staff and you get this medication out. Do you understand? So it's like it makes nursing very, very surreal for you, because you're constantly doing your job, impacting people's life, and you're seeing them getting better, like through administration of medication and looking after them. And another thing I would like to also mention is that, like back home in Nigeria, based on this availability issue, there are a lot of things that are unavailable. Like for instance, if a patient is brought in, a casualty is brought in, there's no oxygen for this patient, and they think the family, and there are oxygen, we're going to buy oxygen for this patient. We don't have oxygen tanks in the hospital, or oxygen tanks are finished. Do you understand? Are finished. Can you go and buy in this place? Or there's no blood in the blood bank in the hospital. Can you go and buy in another facility? And these are things that I've never even witnessed. All of my 2 years, I've never witnessed it happen in the UK, because each patient has like an oxygen port just behind, and when the patient desaturates or need oxygen, having respiratory distress, you are on the ball of your game to sort of like pop up the oxygen, you know, do whatever you need to do for the patient, get the patient better. So I feel like that's another thing. And I remember back when I was in Nigeria, there was a time whereby like there was, I think, power outage, and power outage affected like water in the hospital, so we were not able to wash our hands. Like that was like one of the things that like just triggered me, like, oh, I think I need to like move, because I need to see nursing in a better form. There was no water to wash our hands, and we were having to beg patients like, oh, can we have some water from you? Because some patient had bags or sachet water, pure water. So we're like, can we have a sachet water? And the patient relatives were like, no, what you know? And they're on their rights, because they actually buy these things themselves. And those, each patient also has to buy their supplies like gloves. So like, I don't know if it's changed now, but then they had to buy like their supply like gloves. So if you want to do anything for them, you have to pick gloves and do what you want to do for them. Some patient relatives also like count the gloves, and they put like very minute gloves in the box. So when you want to do something for them, you must be able to use like within that amount of specified gloves. If it's finished, then it's finished. Do you get? It was just like giving like an eyebrow, because most times as a nurse, you need gloves to do like a lot of procedures for this patient. I'm like, okay. But here, I've never experienced it in my 2 years of being a nurse here. I've never experienced like gloves going finished, water going off, and I've never also experienced power outage in my 2 years of being a nurse in the UK. And that's a positive. I'd like to talk about the benefits you get as a nurse working in the UK, or working in the hospital, or like working in the hospital, or working with the NHS, or working as a carer. So there's some benefits, like you get discounts for some products, and there are some times whereby like maybe festive periods you get a lot of discount from like maybe Uber, or various companies give out coupon codes to staffs, to get discounts off some things. So I feel like that's a very nice one, because I always use that for shopping my scents to get my 20% discount. And also some shops, some high fashion street brands, they're like giving discounts to like NHS workers, carers, and all that. So you're like, oh, that's like a thumbs up. But I think in Nigeria there's nothing really much like that. And also you've got leaves. I think you're entitled to 206 hours a year, and that's like over 7 weeks. So like that's a big one. I think in Nigeria, I think I don't think you're entitled. I don't think you're entitled. Like when I worked actually as a nurse, I didn't get any annual leave. So that's why it sort of like glitched. Like, oh yeah, I didn't get any annual leave. I only got maternity leave. I think my maternity leave was 3 months. So, and if you want to take the 4th month off, you're gonna go without no pay. But in the UK, you are entitled to a year, and I think 6 months of it is paid. So that's a plus. And you also got other like leaves, like sick leave. If you call in sick, or you're sick, you're unwell, you can't come to hospital, you can't come to work, you'll be paid for calling in sick, for not working that week. I think you can have that sick pay for a certain period of time, as far as you have like your medical backing to sort of back your absence from work, or you got a sick note. But back in Nigeria, if you're not well, if you don't go to work that day, it means you might not get paid that day. So, and you also got bereavement leave. Like when you lose someone, you've got bereavement leave. I don't know about Nigeria, because I didn't experience that in Nigeria. You've also got study leave. If you're going on study for a while, you can like apply, and it will be granted with the knowledge of your manager and everything. Like if you've got study leave, or you're going for a study plan or something, or you've got a lot of trainings to catch up on, your manager can give you some hours. Or maybe you're doing your CPDP revalidation, your manager can give you some hours to come into like the hospital library to get everything done. But it will also be counted as your hours, because you're in hospital and you're working. So that is like a positive fact of it. Like a friend of mine just recently changed jobs, and she had like a lot of trainings to do, and she was like in hospital doing her trainings, not yet starting clinically, and she was being paid because she was working. She was carrying out are training to start working. So you know, I'd like to talk about is the shift pattern. Oh my god, oh my god, oh my days, oh god, that is like one of the things. It be things, is a real thing, that shift pattern. Like back in Nigeria, I used to work morning shift and night shift, and it wasn't, the level of stress wasn't really, you know, up to it. And even though it was 5 days, and I think in what's it called, in federal hospitals, you have morning shift, afternoon shift, and you have night shift. So you're basically doing like 8 hours or 6 hours. Yeah, 8 hours or 6 hours in between. But here in the UK, you're literally like obliged sometimes to cover a certain numbers of hours per week, like 37.5 most people, and some people even do 40 hours or 48 hours. So like you you'll be able to do, like, you need to do like long hours, because for you to cover up those amount of hours in that week, you will need to do like long hours, so you can have a long break of work. So for me, when I came, it was a really big struggle for me as a mom, and because I had my child was still very little when I came to the UK. It was very, very stressful, and it took a very big toll on me. Like, I think for the first 3 months or 4 months, I lost mad weight, and because the units where I work is very fast paced, it was a very drenching moment for me. And the fact that you have to stand throughout, because you've got only an hour break, you have to stand throughout, there's no sitting, there's constantly things to do, is another thing. So the shift pattern you have to put into consideration. Like, you go to work 7:30 in the morning, you're coming back 7:30 at night, like the whole day, and you're constantly on your toes. So that is just like one of the things. But I feel like as the longer you go into, the longer you start doing it, like, I've gotten used to it now, to like the long hour shift, and I even do extras now. Like, when I look back, I'm like, really? I even do extras now. So I feel like it's something that you can overcome. But just prepare anyone's mind planning to move or come to the UK. These are one of the things that you might find like oh, okay, funny. So, but you'll be fine. You just need to go in with your, like, your food, sweets, chocolates. Like, there's always just something to munch on just to give you that glucose to keep on, you know, to keep on going. And you also need to have your own paracetamol and stuffs in your bag, just in case you feel a little bit of a light headache, because that headache is not, it can't be extradited. Like, you can't push it onto one side, that headache, because constantly while you're working, you feel like you're having a headache. At some point, I just feel like, oh god, my head won't blow, and I'm like running to like the nurse in charge. I'm like, please, I'm just going for my break now. She's like, oh yeah, you can go for your break. So like, when you feel like you can't put up with like what's going on around you, and you need a break to just go and eat, relax, refuel, and come back in and just continue your work. So just be ready if you're planning to come for that long hour shift. And the same as well with night shift. But I think night shift in Nigeria is just same, like you come in the evening and you go back the next morning. But like the day shift pattern is like a little bit weird. One thing I like about the UK is like the ability to do extra shifts. Like back home in Nigeria, you are contracted for certain hours, and I don't think you can do more than your hours. Like, you literally work 5 times a day, a week, and you have 2 days break. And there's nothing like extra shifts being put out, like, oh, we're having this extra shift for you, can you come in, or we need someone to cover. The only thing they do is like, oh, can I swap your shifts, we need somebody to come in this day. Or do you understand? There's nothing like extra shift, and doesn't give room for ability to like grow in other areas, and doesn't give room for ability to sort of like make more income. Like in the UK, if you're working on your contracted hours, you can always pick extra shift, because if you're working 37.5, some weeks you work 4 days and some week you work 3 days. So on the weeks that you work 3 days, you have 4 days to rest. So you can always pick in like an extra shift. Like most people I know do like 1 extra shift every week, and the week you are booked, you have to work 4 days. You can pick 1 depending on how you've got strength, and that 1 is able to like, you're able to like work in other units, and you're able to like make a good, you know, ends mean from that. And that's like one thing. And another thing I also talk about is like the pay. The pay from in Nigeria is really really poor compared to the UK. Even though the pay in the UK is not really right there, I'll say the pay in Nigeria is really like very, I mean very poor. I won't be talking about the figures because I know that people watching from Nigeria, at least you know, like you know what the pay is like. And the pay in the UK as well is not so great compared to other countries, but it's still something that can, you know, give you a good life, especially if you're like maybe a single person, or you've got like a supporting partner. Is something, the salary is enough to feed you. Like you can't go a day hungry, and you can't go lacking anything. You might not be able to do like your lavish lifestyles and, you know, all the, but you can still make ends meet for him, and you can still book vacations, you know, do great things for yourself and do great things back home. So I feel like yeah, the UK is actually a positive place to come to as an international nurse. Like it's a positive place, gives is like a stepping stone for a lot of people, and it opens your eyes and give you that career, you know, that experience, that international experience, that you can work anywhere else in the world. If you work in the, if you're a nurse in the UK and you're planning to move anywhere in the world, it's very easy for you because you've got that international recognition and international experience. But apart from everything, like everything in my experience I've mentioned, I feel like the most paramount thing as a nurse in the UK is to try and protect your pin, and try and do what like what you know is right, and what you feel competent in. And I'm talking about my next part in this experience, story is going to be competency. Like in the UK, there's something called competency, whereby you can't do things if you're not competent about it. Like in Nigeria, I used to do cannulation. I can cannulate a patient, put in, you know, IV fluids and all of that, administer some medication. But when I came to the UK again, I had to do like another competency training. They had to teach me, oh, what is an IV, what is an artery, what is a vein, and these are things like, oh, I know back home in, you know, in Nigeria, but because they just want to reorientate you and give you that, you know, fresh knowledge, they still book you on that training. And after you be able to put your cannula in, you know, after being supervised like maybe 5 times by like a senior personnel, they'll tell you, oh, you can put the cannula in, now you can start doing it on your own. And sometimes if you've got things that you're not competent about, or you've not got training on, you are able to say, oh, I can't do it because I've not got a training on it. Like no one is going to hold you accountable. It's on the what's it called, the NMC code and conduct, you know, to prioritize your patient, to practice effectively, to, you know, to ensure your patient's safety. So you can't, if you don't know something, you can't do it because it's not going to be safe for your patient if you're not competent in it. So that's where, to promote patient safety, and that's where like everything comes in. Like, oh, there was a time whereby there was this particular nutrition bag that we put up for patients, and I've never experienced that in Nigeria. The only thing I'm aware about in Nigeria is putting an NG tube in, and you know, giving nutritional supplement through the NG tube. But here in this scenario, there's like a nutrition bag that you have to put up, and it goes into like a major catheter, like a PICC line or a midline, and you need to have training for it. So like none of the international nurses like had training for it, and had to be like a senior nurse that had to come and put it up. But in between that part of like putting that up, you have to be supervised like 5 times before you're able to like put it up. So that's where like the training and competency part comes in. But in Nigeria, I don't think there's any like thing like competency checklist or competency whatever. Because if a patient comes back from like surgery, or you want to do anything for a patient, or a dressing, they also automatically expect you to like do it on your own, like do the dressing. You're not allowed to say, oh, I don't have, I know dressing is a thing that you can't say you don't have competence in dressing, but like you're not allowed to say, oh, I don't have competence in this thing, because you already allocated your patient. It's only if you then try, or maybe you're trying to put in an NG tube, you then try and you don't get it, then another nurse can also try Do you understand? None of us can also try, because they like expect you to like be taught these things back in your nursing school, and you should be able to do them. So that's like another raised eyebrow. Or like catheterization, you like like you can't say, like you can't tell your nurse in charge or like your matron that, oh, I don't know how to put in, I'm not competent with catheterization. But in the UK, as a nurse, when you're starting, because starting at like a newly qualified, you are being supervised to put in catheters. Like catheterization is like one of the most chill thing for me. And coming to the UK, I have to put in catheterization. And another thing that broke my what's it called, broke the camel's back, is like we do male catheterization as well. I'm like, really? Because in Nigeria, doctors, I don't know, depending on your setting, doctors do male catheterization. So I'm like, really? This, and that was something that I was able to learn like over the years, and I've been able to like achieve that competency and able to put in that male catheterization. But like for female catheterization, it's like, oh, something that we do every time in Nigeria. Nurses just put it in, and you know, that's the, but because you're coming to a new environment, you have to do this training again. I feel like it's positive. It makes it sort of like settles you into the environment and makes you know what you're doing, understanding that, oh, this is how things are being done. It's still like nothing is same everywhere. It's still the same, maintaining your ANTT, but their supplies can be different. Like they have male catheters and female catheters, and those are like the things that you need to, you'll be able to like learn in between. And I feel like it's a positive one. About my experience in the UK is that I realized that there's a big role for the MDT team, like multidisciplinary team, the doctors, the nurses, the physios, the OTs, the pharmacists. Like a doctor can say the patient is being discharged, but the patient is not going home because the OT has not discharged the patient. Like the physiotherapist has not discharged the patient. They've not said, oh, this patient is able to do these things alone. Like, so I don't feel safe for the patient going home. Like discharging a patient or carrying out stuff on a patient has to be like a multidisciplinary team approach. A consultant can just say, oh, we're doing this, especially if it's something that needs like a higher level of discussion and higher level of, you know, planning. A lot of individuals from different teams will come in together and say, oh, this is this, this is that. And I feel like it was something that caught me on surprise, because in Nigeria, when a doctor sees you, it's just like, oh, patient is discharged, and the next the patient is going home. And sometimes even if the patient like is not able to do some things on his own, and you're even considered as a nurse, but doctor has discharged the patient already, and the patient is happy to go home. But here in the UK, even the pharmacists go through like the medication the doctor prescribed, and most times pharmacists even give their like recognition to like their recommendation. Oh, the patient blah 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 weight so and so. The patient the therapeutic dose is this. The patient can have this dose. Like everything is documented, and the doctor also takes like opinion from like the pharmacist, takes opinion from like the nurses. It's like a lot of like it's been so lovely and amazing working in this environment, because there's no rift, there's no any conflict of like power conflict that, oh, does the doctor think that he knows more than me? Like I've experienced that happening a lot in Nigeria, like with a lot of things, maybe blood transfusion or anything like that, and the nurse is like, you can't do this, you can't do that, and doctor is like, oh, I prescribe it, the patient is going to, you understand, the patient is going to have it. There's a lot of like basketballs going on. But here, trust me, you have a very, depending on where you're working, and that depends on your colleague, but I feel like in general you have a very lovely multidisciplinary team approach with like the doctors and the nurses and the OTs. Like they even come to you, who are you the one looking after this patient, this that we've assessed this patient, it will now be on a Zimmer frame, will now be on this. Like they carry you along with like everything that is going on, and you feel part of the team. And most times when maybe a dietitian is coming to review this patient, they come to you, oh, can you give me an handover about the patient, and this patient be eating, like things like that. It's sort of like, you know, makes you feel the teamwork and the collaborative effort is very strong. But back home in Nigeria, I don't think the consultant comes in, do a ward round, and the most senior nurse is there taking in. But a lot of times they don't really come to you like to say this, only if they want the jobs to be done. They don't really come to you and say, oh, this patient, and you understand. So it's a lot of like rift in there, and sometimes you call the maybe like doctors to come and do something for you in the middle of the night, and the doctor is like, I'm busy, or like, do you understand, like giving you some sort of attitude. And the nurse will go and write, I noticed that thing when we're not putting our documentation. Doctor informed at 10 o'clock. House officer informed at 10 p.m. House officer states he is busy and he will not be able to come to the ward at 1600. House officer informed again that observation blah 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 blah, and the house officer said he won't be coming again. So like a lot of rift, but here like it's just so simple. You got an online platform, you put your complaints in there. You got nurse practitioners that can actually help you. So it's a lot of like multidisciplinary team approach, and it makes your working experience very, very lovely. Honestly, for the past 2 years, aside from the hospital being very busy, everything I've talked about here is based on my own personal experience. I want you to take this experience as a generalized one. It's just based on my experience, and I feel like it might give people a little bit of insight on like how it is in the UK. And also to mention, I work in the hospital, and it might be a different experience in the care home or maybe in a private setting, because I work in a government setting in the UK. But what I would say is that like everything altogether sort of like works for like its own like good, like having everything automated, having a multidisciplinary team approach. If anything happens, you know what to do. If there's a crash, you know what to call. Like back while I was studying, if a patient becomes unresponsive, most times it is the doctors that take charge of like the resuscitation process. You just call the doctor, and the doctor comes in, does resuscitation a little bit, and the patient, you understand. But here most times nurses on the ward already take charge of the call even before the doctor comes in. Though you bleep, you put your call out, ring 2222, but you are able to do a lot of things, like even before the doctors come. If someone is on chest compression, another person is on getting blood, putting in cannulas, putting the DV patch on, like everything is just systematic. Like I've honestly had a lovely experience in the UK where I'm working. Aside from it being very busy, honestly, that is like a very truthful part. I feel like it's very busy compared to nursing in Nigeria. I know nursing in Nigeria is busy as well, and you're also short-staffed, but you don't have a lot of documentation supporting aside giving medication, doing your chatting your medication, chatting your observations, and that's it. But here in the UK, we have a lot of like checklists that you need to do like on your shift every time, and it sort of puts you like behind. After doing your medication, there's constantly something to do at every point in time, and because of that stress level, you're constantly like working. That's the only thing. The stress level like is a lot different, and there's nursing short-staffed units everywhere. Even in Nigeria, you're short-staffed. Like that's one of the things I felt like I had this notion of, when I was coming to the UK, I'm going to be having just 4 patients, I'm going to be having just 5 patients, but voila, here am I. And the nursing ratio allocation is what I'm having here is even similar to what I used to have back home in Nigeria. That's like a poster for you, yeah. So that's why when I mentioned when I first came in the first 3 months, I lost massive drastic weight, and I was like, cause I've not been on this type of stress level before. I needed to be at my best, you know, to be able to learn in like my new role, and also to understand and put out my best and learn. So at that point, that first 3 months was like a learning phase for me, because it felt like I was doing everything. Even if I had the competence back home in Nigeria, I was learning everything back and back again. Another thing I'll talk about is like the pay in the UK. You are being paid hourly, but in Nigeria you're being paid monthly. As I said, I'm not going to mention the pay because the pay varies. It depends on where you're working, depending on your setting. But I worked in hospital in Nigeria and here in the UK as well. I would say the pay is a lot different, and the fact that you are being paid enhancements back home in Nigeria, even if you do nights. I don't know if it's changed, but even if you do nights, it's still same money. Even if you do days, it's still same money. Even if you work on Saturday, Sunday, it's still same money. Even if you work on Christmas Day or New Year Day, it's still same money. So like there's no enhancement or anything. So I feel like that's a plus on my experience in the UK. You work on Saturdays, you work on Sunday, you get enhancements. You work nights, you get enhancement. I've just finished my 3 block of 9 shifts. Today is like the 4th day. I've just come this morning, I've just woken up, and I feel like let me just do a video. So you get paid, and that's it. Even though the money is like, it's a lot of discrepancies, and people are like, oh, the money is not enough compared to other like countries, but I feel like as a nurse from Nigeria, it is still a lot, and even more than 100% rise of pay when you come to the UK. So I feel like it's a lot of pay, like a lot of the money is quite very different coming into the UK. But another thing you have to notice that when you're coming to the UK, the stress levels and you have your accountability part of everything, as I've mentioned, and that's just it. Yeah, so everything I've said, like I said earlier, is based on my own personal experience, personal journey and everything in the UK for the past 2 years. And like I said, I've worked in the same setting for the past 4 years now, like 2 years nursing in Nigeria and 2 years nursing in the UK. So I'm able to like strike a balance and equate everything. So everything I've said is based on my own knowledge and experience. So thank you for watching this video. If you watch this video until the end, you are the realest MVP. I'm so happy and I'm so glad to be able to do this video, to be able to put this out. It's like a step forward for me, like breaking my procrastination. So I'm just so glad. Please just try, subscribe, like, and also share my video, because we're about to grow this channel until the imaginable stage. So please do subscribe, like, and share my video. Thank you so much for watching to the end. Thank you so much for sticking with me to the end. Love you guys. Bye.